Welcome back to Med School Radio. We are looking at sketchy micro, again, gram-negative rods, respiratory system this time. Gram-negative rods, we're looking at Bordatella, pertussis, board and care. So I'm looking at the image, I'm looking at a PDF, and in the image there is a military man who's in a wheelchair, and he has his leg up on one side of the chair. It looks like he has a cast. He's holding some popcorn, and he has a horn on the side of his wheelchair that says whoop. And looks like he's saying something. Two beds in front of him. I see ribbons on the floor, ribbons behind him, red, white, and blue, and some medals on the wall. It says Victory 100 Days War above the window, and outside the window you can see the tents. There are some crows on the windowsill, and a telephone and a syringe. Outside you can see a tractor. So let's go ahead and read what it says. Okay, number 1, streamers. They're streamers. 2, represent the pili. Respiratory droplets are very infective using pilus called filamentous hemagglutinin. 2, the bow tie, pertussis toxin, ribosylates GI, disabling it. 3, GI uniform, toxic, inhibits GI, disabled GI, G inhibitor protein. Number 4, military camp, leads to a rise in CAMP. Number 5, the popcorn, which represents an overabundance of white kernels. ADP disables chemokine receptors for lymphocytes, leading to an overabundance of white blood cells in the bloodstream. So this is lymphocytosis. 6, the EF shield on the wall. Adenylate cyclase toxin acts like the anthracase toxin edema factor, increases CAMP edema factor when it's most virulent. Number 7, the tractor in the middle of the road cutting the grass. Tracheal toxin damages ciliated cells in the epithelium. Tractor cuts long cilia grass. 8, the vet coughing vigorously. Catarrhal phase, limited symptoms, non-specific. Most bugs, most contagious, 1 to 2 weeks. 9, the whooping horn, paroxysmal. Characteristic cough, the whoop. Number 10, 100 Days War banner, convalescent stage, final stage lasting 3 months with a cough, 100 days cough, most susceptible to secondary infections. And 11, the crows represent the treatment of macrolides. And 12, the syringe with the cell phone, the DTAP or DTaP acellular vaccine using purified antigens. 13, the red hues, gram-negative. 14, aerobic. And 15, it is non-motile. So thanks for joining me here. We're looking at gram-negative rods, respiratory system, Bordatella, pertussis, board and care from Sketchy Micro. Go ahead and check it out. You won't be disappointed.